Good afternoon, and as always, thank you for joining us on this Friday instead of a Tuesday. We promised to come back to you today to talk a bit about gatherings and travel, our recently posted travel advisory. But before we get to those, I want to invite Dr. Erica Pan up to share a little bit about the data, the numbers, the surge that we're seeing. I was asked if we're in the middle of a surge. Absolutely, surge doesn't have a clear definition of what that what connotates a surge, but certainly cases are on the rise here in California, and we are concerned. And as I say to my patients, often, when I'm worried, I'll tell you so you can worry with me, and we're there. So, with that, bring up Dr. Pan and go over our current case numbers.
Great, good afternoon. Thank you very much, Dr. Ghaly. So for today's case numbers, we are at 6,893 cases here in California. This is higher than our 7-day average, which is 6,773 cases. Our total tests are 136,428, and our test positivity rate over the 14 days is 4.0%. When you compare that to a couple weeks ago on October 29th, our test positivity rate is 1 point higher. Again, it's 4.0% as of today, a point higher than 2 weeks ago. Our hospitalizations are also increasing. They've increased over 34.6% over the last 2 weeks. It's currently at 3399. And our ICU hospitalizations have also increased over a third over the last 2 weeks, currently at 931 ICU hospitalizations. So we wanted to reintroduce you again to this epidemic curve. We showed you this on Tuesday, and this is how we look as epidemiologists and public health officials at what is happening in our community, and this is what is happening in the state of California and where we've been. So our slow and stringent approach has allowed us to gradually reopen a significant number of counties over the past couple of months. You can see here that the number of new cases per day has increased dramatically since the beginning of November. So you see the rate of rise that we saw in June, and that was a 39.2% increase. And here, since the beginning of November, in just the same 1 week period, it's been a 47.1% increase. This is almost a 20% faster rate of rise and the fastest rate of rise we have seen in California. When cases are increasing at this pace, it is really important for us to act quickly. Every day makes a difference and time is of the essence. We need to remember the basics that keep our cases low. As I also mentioned just now, our hospitalizations are increasing, and we did see a peak in July, and our concern with this rapid rate of rise is that the peak could be even higher if we don't act soon. So again, our blueprint has been working very well. We've been allowed to loosen, and we also can restrict. So we are actively discussing this with our local health officials and our counties and internally to determine what we can do about this rapid rate of rise and how we could potentially consider the emergency brakes that we've built into this framework from the very beginning. And with that, I will turn it over to Dr. Ghaly to tell you more today.
Thanks, Dr. Pan. Certainly, we always hope to have positive news, and this isn't really positive news. These case numbers are surging, and I'll just punctuate a point that Dr. Pan made, which is as we look at this rapid rate of rise in cases, nearly 20% faster rate of rise than we had originally. What we know about cases is about 2 weeks after a case is reported, or a set of cases are reported, we see about 12% of those cases end up in the hospital. And when you look at a high number of cases day over day, and that's sustained, that's exactly what we worry about in terms of overwhelming our hospital system, making sure that hospital system's available to take care of not just people who are sick with COVID, people who are sick with the flu, but also individuals who might have other routine health needs, other emergency health care needs. We need to make sure that our system is ready for that part of our population as well. So This is an important immediate situation. As Dr. Pond mentioned, our emergency brake, this concept within our blueprint that says even though we move slow and stringent forward, if there are signs and signals in our data to move back with expediency, with decisiveness, with partnership in our county local leaders and local health jurisdictions and our health leaders across the state, that we will look at that closely, and we have been and will continue to, not just during the week, but over the weekend as well. So I want to also come to this concept of what is a high-risk situation. We talked on Tuesday that there are certain characteristics of our activities and events that are higher risk than others. Just by way of reminder now, activities where it's difficult to mask the entire time. For example, when you're eating and drinking, that creates a higher risk situation. Activities where you see people who you haven't seen recently, people who are outside of your household, creates a higher risk situation. I'll punctuate this again later, but this idea that just because we're personally close to someone, a family member, a really close friend who we haven't seen in a while, that doesn't create comfort when it comes to COVID. We may actually put our guard down, take our mask off, get a little closer than we should. And that's exactly the condition that creates spread and transmission of COVID-19. Activities where it's difficult to keep your distance, important to try to avoid those. Multiple people at a small table for a meal, for a board game, all of these things can create additional risk. Activities of longer duration are also important, and activities that don't allow for plenty of fresh air to circulate. We've been emphasizing being outdoors, being in maybe covered canopy situations outdoors with as many sides open as possible. But even if you're indoors, windows open, doors open, getting as much of that outside air circulating as possible helps reduce the risk of transmission. So how is all of this relevant? Well, today I'm going to talk to you both about the state's new travel advisory, joining Oregon and Washington to do the same, and then update on our gatherings guidance. So as it comes to the travel advisory, we've been talking about this for many days. We've looked and seen what other parts of the nation have done. We've talked to our partners in Washington and Oregon. We've discuss this with many of our public health leaders across the state. And of course, there's consensus that travel, having others travel to your home could potentially cause increased transmission. And with that in mind, we have put out this travel advisory. It isn't a ban, it isn't a restriction, this is an advisory. We chose to go with an advisory because for many, many months, we've recognized that this partnership with all Californians to choose to do things that we know reduce spread is an important one. That together with this advice on what to do as it comes to travel, that sector of personal responsibility that I've talked about before, this is an added element. And we're encouraging Californians to stay close to home, to avoid non-essential travel to other states, other countries, and frankly, across the state if that's avoidable. People arriving in California from other states or other countries should self-quarantine for 14 days. This is not a new concept. This is something we ask people to do very early on with our partnership with our local health jurisdictions. You've seen this across other states, across the country, and we believe that this is exactly how we can add to our toolkit to reduce spread in California. This is especially important as we've seen test positivity and case rates surge even higher than what we're experiencing in California in other parts of the state. And the idea here is that with the self-quarantine for 14 days, it should really be limited to interactions with their immediate household and not mixing with households that they've come to California to visit. And this also carries forward for people who leave California to visit someone. Maybe it's over the holidays, maybe it's for another winter event that's coming up. When they arrive back in the state, the recommendation is for a self-quarantine of 14 days. So the other element I said we would discuss today are our small gatherings guidance. We know that as the weather has turned to colder, many of us have COVID fatigue. I even think about resentment towards COVID, that it's important that we give you the tools and the knowledge of how to reduce risk. The safest gatherings remain those that happen at home with members of your own household. We encourage Californians to gather virtually whenever possible. And when you are gathering with others, to have it outdoors as much as possible, because we know that that significantly reduces the risk. So here is, we've been talking more and more about providing relatable messages that our public partners, all of you in your homes and in your communities, can not just understand, but can imagine implementing in your own lives on a day-to-day basis. And really it boils down to these 7 things that you see here by each checkbox. So the first thing is we ask you to check your local public health websites for restrictions, because not every county, not every area of California is experiencing COVID in the same way. And you may have local restrictions that are tighter than where the state is. We, of course, always start with wear your mask. This is very important, especially as you consider not just gathering outdoors, but how to reduce risk indoors. And we advise you to keep your mask on as much of the time as possible. The urge to take it off towards the end of a gathering that maybe comes during the time where you're sharing the meal, sharing food, sharing drink. We urge you to, as much as possible, keep your mask on so that we reduce the amount and exposure of potentially air droplets with COVID. Keep your distance and spread things out. Some of us have additional space, maybe having people spend time in rooms that aren't just your living room or your dining room could be an important strategy to keep people spread out. And this is important not just as we travel outside of our home, but even while we're at home, if there is any chance that you'll be spending time indoors with people you haven't seen in quite some time. We ask you to keep it small. We've talked about this 3 household concept outside that really we're asking you to consider doing that indoors as well, that minimizing the opportunity for different people mixing and interacting not only keeps your gathering small, but it reduces the likelihood that you'll be mixing with somebody who was themselves exposed to COVID outside. Keep things short as well. The shorter, the better. We've emphasized that. So instead of having a 3 or 4 hour gathering, consider keeping it to 60 or 90 minutes. Still enough time to see people that maybe you haven't seen in some time, but short enough to make sure that we don't take our guard down throughout any part of that short gathering. Keep your windows open. I mentioned this before. I know it's cold outside in many parts of California, but keeping the windows open and outside air circulating is an important key to reducing the likelihood of transmission of COVID. And finally, and this is not least, this is one of the most important, protecting our older and at-risk friends and family. We know that there's a strong urge to meet with grandparents and aunts and uncles who we haven't seen very often or at all over the last many months. But this is exactly the time to keep your guard up. And if you must, and we urge you not to, invite those who are older and higher risk to any gatherings. But if you must, really try to discuss ways to protect those family members, ensure that they have the right mask, make sure that you've talked to all of the participants in the gathering to do all you can to protect that person or those people so that we don't increase the risk of not just transmission, but transmission in the population that we know is at higher risk. I'll remind you, all Californians, that just over 10% of our cases are in individuals over the age of 65, yet that group over age of 65 makes up nearly 75% of the deaths in California from COVID. So punctuating the point that we need to protect those who are most at risk. By way of some reminders here, just as I was saying, the people who are highest risk for severe illness or death are those who are older with underlying medical conditions, and we strongly urge you not to attend gatherings, especially indoor gatherings. If you do gather with older individuals and people with chronic conditions, make sure they wear a surgical mask. A cloth face covering is sufficient in many, many settings and for many, many individuals, but having that added protection of a surgical mask can make a difference. It's also safest, and I'll remind you, to celebrate the holidays with people you already live with. But if you invite others over, please keep it at a maximum of 2 other households so we reduce the number of individuals in a setting, but also that we reduce the chance that we end up having COVID spread from household to household. And then I'll end, before we get to our routine, common end of a presentation slide with all of our reminders, to tell you that yes, travel increases your chance of getting and spreading the virus. Incoming travelers from out of state should self-quarantine for 14 days after they arrive before mixing indoors with others. And those who leave California for travel and then return should do exactly the same. So before we turn it over and take reporter questions, I'll just remind you, keep your mask on, maintain that 6 feet of distance, wash your hands 20 seconds with warm water and soap, important added step. Minimize mixing as much as you can. Stay home when you're sick. And if you haven't already, get your flu shot. It's an important protection of not just you, not just your family, not just your community, but it's something to do for our hospital systems, our healthcare delivery systems, and all of those sort of healthcare warriors working in our ERs, in our ICUs, on our hospital wards, our first responders who also need you to help protect them during this critical time. So with that, I'll turn it over to reporters for questions.
Claudia Peshueta, KNX News Radio.
Dr. Ghaly, I have a couple of questions for you. First of all, what might the emergency breaks look like? 2, LA County schools are being told to prepare for the possibility of another complete shutdown. I'm wondering if you think that's a necessary step at this point. And then my last question is, given the fact that the state is in the midst of another surge and that you know that eating and drinking is a high-risk situation, what do you think about the fact that the governor last week attended a birthday party with people from several different households and the message that might send to residents? Thank you.
Yeah, let me go to your last question first. The governor has put out a statement. And I'll point you to that statement. And of course, my focus is on ensuring that we deal with the reality of surging cases, that the guidance that I provided today and that we've been working on with our local health partners around activities where you might gather indoors to reduce risk is really the message that we want to get out to our public, and really pushing that is important. And that's part of the reason why I'm back with you today on a Friday as opposed to the normal Tuesdays. As it relates to the emergency break, thank you for that question. You know, we have always said in our blueprint that we could see things have to shift more quickly. We left that as a characteristic of the blueprint. We haven't hid behind that in any way. And now may be the time where counties move back a little sooner than just waiting 2 weeks. Maybe 1 week is enough, that the data is so compelling that the transmission rates, that rate of rise that Dr. Pond mentioned, county by county, could be compelling enough to cause counties to not just move back faster. We've to date really had counties move back just 1 tier at a time. That may not be appropriate to get the kind of response that we need to blunt that rate of rise that you saw. And then of course, we've often allowed counties to wait a full 3 days before reverting back to the tier, the more restrictive tier that they are being asked to move to. And even that might need to be reconsidered. So there's a number, those are a few things, but we're going to be working with our local partners to understand what those conditions are, make sure that we do something that is appropriate for each county, for each region, and those are the elements that we may put in place. And it's not inconsistent with the current blueprint. It was always there, and now may be the opportunity where we have to use those tools. As it goes for LA and the schools, We have made schools an important priority. We are working with, despite the surge in cases, making sure we emphasize all the protective factors, things that we've provided schools, both at the state and the local level, to be able to reduce risk, things like appropriate PPE, things like access to testing, guidance on how to set up classrooms and campuses in a lower risk way, knowing that we will always have and continue to have distance learning as an option when schools or cohorts in a school need to sort of go back to distance learning. So we continue to push forward with all of those preparatory arrangements. But if a district in a county, or if a county in its entirety decides that the transmission rate is too high for a number of reasons, we're going to work with those counties, including LA, to be ready for when transmission rates come down again, so that schools can come back and students who depend on in-person learning to get the level of education and the development that they need, with teachers and staff who are prepared as well, that we're ready to go as soon as it is deemed to be appropriate to return.
Ron Lynn, Los Angeles Times.
Hi, Dr. Ghaly. Thanks again for speaking with us and taking our questions. Counties like LA are already in the most restrictive tier, so what kind of additional closures do you think might be needed? Is it things like closing outdoor dining and gyms and reducing capacity at stores, or do you think we need to do another statewide stay-at-home order? And then one other question, do you have any recommendations for Black Friday? Should we avoid going out shopping in person on Black Friday? Thanks so much.
Yeah, thanks. And you're asking, both questions are really, really critical. The first one is, purple is our most restrictive tier. Many counties in the state are already in purple. Others are moving there. And we're going to be working with those counties to determine, we have better information about where spread is occurring in each county. We also know more than we did in March, the sorts of activities, as I walked you through in the previous slides, some of the characteristics of high-risk activities. So we'll be looking at those, and if additional changes to the purple tier are required, we will be working with our local partners to determine what's there. But first and foremost, we're going to continue to use the blueprint to be that tool that restricts. As we've always said, it's a tool not just to loosen, but to tighten our restrictions as well. And we believe that it's helped us so far, and that we will continue to count on it now. We are not looking today at a statewide stay-at-home order. We know that many Californians are fatigued and tired, and that we are continuing to work with our partners, all 40 million partners across the state, to really adopt those practices of continuing to wear your mask, minimize mixing, keep your distance, and a number of the others that I remind you of on a regular basis, to really be the tools at the moment. All of that said, this is a quickly, rapidly evolving situation, and we will do whatever it takes to make sure that we appropriately protect the public health of California.
John Woolfolk, the Mercury News.
Well, hi, Dr. Ghaly.
Hello.
Hello. Can you tell us a little bit on the statewide travel advisory, why the state chose to make it just an ask and not a tell, like New York and Alaska, Hawaii, and some other states around the country?
Yeah, I think, look, we have for many weeks understood that the most important asset we have with Californians is working along with Californians. And putting out an advisory, a strong urge guidance on what to do when traveling, but first and foremost to avoid it as much as possible, that is going to be an approach and a commitment to Californians to do what we believe is the right thing. And that is going to help us along the way throughout this entire pandemic. And really taking some of the sense of enforcement and ability to, knock on every door, pick up every phone. Hard to do in any state, certainly hard to do in a state of 40 million, and really focusing on that partnership opportunity with all of our local entities, businesses, counties, individuals is the favored approach. And we certainly hope that the fact that it's an advisory doesn't lessen the voice and the emphasis on how important it is. But we certainly expect that in that sort of sector of personal responsibility that I frequently talk about, that this is yet another aspect of that, and that we believe Californians will do the right thing throughout not just these holidays, but moving forward as we respond to these surge in cases.
Melanie Woodrow, ABC 7 News.
Thank you very much, as always, Dr. Ghaly. Echoing some of my colleagues on this call, given how difficult it is for all of us at this point, even our governor, to keep our guard up and exercise that personal responsibility, should the travel advisory be a ban or a restriction with sharper teeth and actual enforcement? More specifically, especially, I know you just answered this question in part, so more specifically, is there a case positivity rate as we move closer to Thanksgiving that would warrant that?
Certainly, this is all very fluid, and it could. We haven't discussed what that level would be, but certainly these rates of rise that Dr. Pan outlined during her part of the presentation are very concerning. And as we said with the blueprint, an emergency brake means that we will not only implement some of the features that I mentioned, but we're always looking at what is going to help us keep the public as safe as possible in California. And certainly, if there's any indication that the travel advisory needs to be strengthened, we will consider that in the days and weeks to come. But I will punctuate it by saying I certainly hope that the advisory doesn't weaken any part of the message. We believe that this is an important part of how we keep transmission low. We start again by saying, please don't travel. If it's not essential, please consider delaying it as long as you can through this pandemic. But if you must, please respect that 14 days gives you and your family and those you're around the confidence, the 14-day quarantine, that you are unlikely to transmit the virus to them that you might have carried in from a state with even higher transmission than we have here in California.
Scott Broad, Capital Public Radio.
Hi, thanks, Dr. Ghaly. A number of businesses have been expressing sort of fatigue and frustration, as you've alluded to, as the tiers begin to roll back in different counties. Some have suggested that they may not follow the guidance that has been laid out. Right now, a number of counties have taken an additional approach to handling these situations, trying to sort of guide them towards what's required. If there is continued refusal to comply with the guidance in the given tiers that a county is in, do you think the county should start taking more enforcement action against these businesses if they refuse to comply?
So, again, there is certainly a balance, but on the specifics of your question, we believe that enforcement is an important part of helping support Californians to, get through this pandemic. We know and feel and hear about the hurt of many businesses and the difficulty, but we continue to believe that this is not a choice between health and business, that's a false choice, that what we really need to do is do everything we can at this moment to get these very rapidly rising cases back down, bending that curve. The first part of that is reducing the rate of rise, and we need our business partners to be along with us. We know that the simple acts that I talk about, connecting them to the fate of businesses, is an important one. Not only do they keep businesses open, but they keep all of us employed. And so we hope that businesses will choose to implement the guidance, follow our tiering system, and if there is, challenges with that, we look to local enforcement, state level enforcement, to really help guide businesses back into the tiering system, as we put it there. And it's been happening to date, and it will continue to happen into the future.
Anna Ibarra, Cal Matters.
Hi, Dr. Ghaly. My question is about the state's vaccine plan. I'm wondering when we should expect to see a final or more detailed breakdown of who exactly will get vaccines first. And I'm wondering how much of that decision will fall on counties. If different counties might want to prioritize different groups after health workers, are we going to see a distribution that varies by county? And do you expect teachers to be among the first group? Thanks.
Yeah, I mean, all good questions. I will tell you that we're actively working on that. Our drafting guidelines work group has already met 2 times to have the conversations about exactly who is in that priority group 1A, who's in 1B, who comes next. We know that the first that we'll start with are our frontline healthcare workers, our first responders, then looking to those most vulnerable, especially in congregate care facilities like our skilled nursing facilities. And after that, as we have a little bit of time to plan, we'll be working on putting that out as soon as we have agreement and consensus. We believe that the state's guidelines will do a lot to inform the counties. If there are counties that decide to prioritize slightly differently, we'll have those conversations as they are appropriate. And of course, teachers, as an important part of our workforce, will be a priority, but exactly where they fall after that 1A priority group is yet to be determined.
Alex Michelson, Fox 11 News.
Thank you, Dr. Ghaly, and thank you for taking our questions. A follow-up on Claudia's question about that the restaurant experience for the governor. And there are a lot of people out there on social media, especially today, who are saying, do as I say, not as I do. I'm wondering what you say to those critics as you're trying to voluntarily, have people listen to what you have to say. And also, when it comes to the restrictions, as you mentioned, the purple tier is the most restrictive thing. We're still seeing increases in these places with the purple tier. Are we going to add to that purple tier and make things more restrictive? Is that an option?
Yeah, again, as it relates to the first part of your question, I'll point you back to the governor's statement and his team in the governor's office for further follow-up. But certainly, as we look at surging cases, we have the guidance and the tips for a reason. We believe they are the strategies to keep ourselves and our communities safe, and we hope and expect people to take them seriously. It's important and it's sobering when people do find loved ones who are infected, who have serious consequences, and even when loved ones die, that those are avoidable situations in many, many cases. And the tools and tips that we're providing, especially moving into the winter and the holiday season, that they are even more important in keeping our guard up, no matter where you are, indoors, outdoors, with people who you're not familiar with or haven't seen in quite some time. It is absolutely critical. And that is, for me, the overwhelming message, not just of today, it has been for a while, but it punctuates where we are today and needs to, I hope every Californian does consider how they can do that and do it even more than they have been in the past. As it relates to a more restrictive purple tier, as I said, we certainly could consider what those activities will be. But I will say, first and foremost, that case spread, even in purple counties, is not unexpected when the baseline transmission rates across our state, across our nation, are as high as they are. The tiering system is really there to help us reduce as much risk as we can, and that's whether the transmission rates are really low or as high as they are today. And I just call upon all of us to consider what we can do in those purple counties. I myself live in Los Angeles County. I've been talking to my own family about how we are going to adjust our own behaviors, considering the surge in cases and the fact that Los Angeles County, like many other counties across the state, has seen a near doubling, if not more, of their average daily case rates in the past week or two. And that's important to keep in mind. So, not that more restrictions won't come, but we are imploring and asking Californians to consider what more they can do, whatever tier their county is in, but in particular, those purple tier counties where further restrictions are not yet outlined.
Christopher Intagliata, NPR.
Hi, Dr. Ghaly. Thanks for taking my question. This is a question about the state tier system, and now that counties are sliding back into these more restrictive tiers, I'm wondering if we're dialing back the economy in smarter, more nuanced ways now than we did in the spring, based on what we know about how the virus spreads. And can you give an example or two of that, if so?
Yeah, I believe we have. I think the whole tiering system was based on updated science and information and experience. In many ways, in March, we looked at really just blunt tools, statewide stay-at-home orders, closures of sectors that we had a sense were high risk, but weren't sure because the data was still evolving. Today, we have good information about the activities that I explained earlier that create a higher risk of spread. And as we get transmission rates higher, those are exactly the kind of sectors that become more restricted and in some places closed down for a period of time. But even in the purple tier, there's some activities that weren't so much allowed early on because of our learnings about things that reduce risk in some of those settings. So you can look at the tiering system in the exact sectors and apply some of the basic conditions of a high risk setting versus a low risk setting and see why those different sectors are assigned in each of those tiers. And so as counties move back, that's exactly what drives what is and isn't allowed to occur from a business or social sector perspective.
Audrey Levokis, KCRA 3.
Hi, Dr. Ghaly. My question is in reference to that travel advisory and the 14-day quarantine period. The travel advisory is coming pretty close to Thanksgiving, and for people who are working during the pandemic, they've likely already made their travel plans if they're going out of state. Are you asking them to lose out on potentially 2 weeks of work to quarantine when they come back?
Really, we're asking people to first consider whether that non-essential travel is the right thing to do now. I think that's first and foremost. We urge people to consider staying close to home, staying at home, staying with their household, experiencing loved ones virtually, on the phone, by Zoom, by whatever mode they can imagine, but really choosing to make that decision today rather than risk getting infected themselves or additionally bringing home the virus and having it transmitted in our workplaces or in other parts of our state, especially given the levels of transmission that we see. But if the choice is made to go and travel, we do urge people to do the 14-day quarantine when they return, because that is one of the first lines of defense at reducing transmission after such an experience. So the quick answer to your question is yes, that is our recommendation. That is what we're asking people to do. We know it's not an easy thing to do, that it creates a hardship, but we know that if we're going to get through this really difficult time with surging cases, that these are the important steps that we need to make as personal and individual choices.
Dan Albano, Southern California News Group.
Hi, Dr. Ghaly. I was wondering if you could give an update on the guidelines for high school and youth sports to return to competition. That was a topic earlier this week, and I wonder what your thoughts are today with the travel advisory being reinforced, when it's very possible that youth sports families are traveling today out of state for a competition, and in Irvine, there's out-of-state swimmers that are competing in a USA swimming competition. Thank you.
Yeah, thanks for the question. And I know I've said this now a couple of times when I've gotten this question that it's coming soon, and it really is coming soon. We are finalizing it in lots of conversations with stakeholders who care deeply about this guidance, making sure that we're following the science, understanding what's possible here in California, respecting the fact that we're seeing a surge in cases, and knowing that the timing with this is important in everything. So stay tuned, it will come out soon. As it relates to the application of the travel advisory, absolutely. If family is going to take the risk and travel out of state to compete or practice for a youth sport or any sport, that we're asking them, first off, not to do that, to make the decision to stay local, stay home. That certainly having kids myself, I understand the excitement, the urge, the fact that we miss it, the fact that our kids are having challenges, not playing and practicing their favorite sports. But this isn't the time to put our guard down, and this is one of the important parts of keeping our guard up, avoiding making the decision not to travel. But if it turns out that you do and you make that decision, we do urge you, anyone around you who made the same choice to quarantine for 14 days upon return, so that we make sure that the decision that you've made doesn't impact a broader part of your community and the state overall. In many ways, what we need to do is keep in mind that our hospital system's capacity, that the protection and safety of our frontline healthcare workers depend on our decision. We're seeing that in other states. Overwhelmed emergency rooms, hospitals without enough beds, without enough staff. And we are giving all of this guidance in order to avoid those situations here in California. We've been fortunate because of the work each of you have done to avoid that in large part, and we can do it again, but making the decisions around travel during this time are part of keeping that guard up.
Brody Levesque, Los Angeles Blade.
Hi, Dr. Ghaly. About three of my colleagues answered all my questions, so I'm going to take this in a different direction. In the last week or so, I've been speaking to members of the LGBTQI community who identify as Latinx, Latino, Latina, and some Asian American LGBTQ people beyond Los Angeles County, working into San Diego County, the Imperial Valley, even out in the Coachella Valley, in that area. One of the things that I'm hearing from them is they're not getting a lot of good information coming out of the various health departments, and they're not seeing too much from Cal Department of Health in terms of advertisements or messaging in their own language. And the other concern they've got, it revolves around the issue with masks, which, as you know, has become so highly politicized, and now the vaccine seems to be headed that direction as well. They wanted me to ask you directly, since you're the Secretary of Health, what efforts are you and your staff going to make to kind of put their minds and their communities at ease and get a little bit better information out there? Because there's a lot of things being said, but not a lot is being directed at them. This is what they're telling me, so I'm relaying it to you.
Yeah, first off, thank you, Brody, for the information. Often the questions that I'm asked are informational for me, and this is a good example of that. I think what we have certainly clearly sensed over the past many weeks and months is the need to improve our own relatability with our messages. I think identifying all of the populations, I mean, California isn't just 40 million people strong. We are as rich in our diversity, and the need and really the requirement for us to communicate clearly and effectively with all of our populations is important. I won't tell you that I can point to the specific piece of public service announcement or mask message that I would point to at the moment, but I think that you just highlight our ongoing focus and need to improve our messaging and our ability to relate to all Californians. And I hope the next time you ask me a question, give me a little bit of time, you will say, you will highlight the improvements that we've made in some of these areas that you frequently ask us about.
Final question, Victoria Colliver, Politico.
Hi, thanks for taking my question. Last one here. My question has to do with the Central Valley region. It's been obviously a early and stubborn hotspot. The state put a lot of resources in there. Things improved, like the rest of the state, things going in the wrong direction. I'm curious if there were things that you learned from that intervention as a state that could be helpful or particular to that region in helping it reduce the spread. Is anything different about that than other parts of the state that you've learned since you put some time and attention there?
Yeah, thank you, Victoria, for the question, and thank you for bringing up the Central Valley. In fact, because of the surging cases, reinvigorating that Central Valley focus and task force has been among our priorities, working with those county leaders and really thinking about it regionally. I often say we have the county structure in California and we use it often and frequently, but then the truth with COVID is it doesn't respect and maintain county lines. So thinking about this regionally as we did in the Central Valley has been an important illustration and effective tool in sharing best practices, because often the counties share a culture, share a different majority ethnic groups, etc. So we have increased our ability and thoughtfulness around what sort of messaging and communication tools work in the Central Valley, different than, let's say, other parts, the northern part of the state, certainly the Bay Area and Southern California. Our work with various employers, focusing on the agricultural industry, focusing on certain factories and other entities that predominate in the Central Valley, really revisiting sort of how the essential workers in the Central Valley, both not only how they work, but when they return home, some of the conditions that they return to, often living in multi-generational families, often living in tighter living quarters, that all of those have guided the messaging. And certainly, for example, when it comes to isolation, when somebody has been tested positive, and an influx of mobile testing, an influx of some of the other state-sponsored, county-sponsored testing opportunities have been brought to the Central Valley. But then when tests are positive, the reality that not everybody can simply isolate, that it's not easy to find a room free from anybody else, a room in a hotel where it might be cost prohibitive to stay there for 14 days, that there are other things that people can do to reduce their risk, keeping a surgical mask on as much as possible, reducing their time outdoors. These are tools that we have learned through our experiences in the Central Valley that are opportunities to do isolation a little bit differently. Although we know that if you can isolate completely for 14 days, that is the surest fire best way to go. But if you can't, there are certainly things you can do to reduce the risk of transmission to others. So all of those are lessons we learned as part of our Central Valley partnership and experience. And I in no way want to give the impression because it isn't done. It is now just being focused on even more. And as we focus not just on the Central Valley, but other regions of California, we look forward to implementing the lessons that we learned there and in other parts of the state as we address the pandemic. So with that, I know this just shy of 2 weeks from now, an important American holiday, but then so many other important events that come with the late fall and early winter. Today's message is really about how we keep our guard up, how we make additional decisions to not just keep ourselves and families safe, but our overall community, our healthcare delivery system able to serve the needs of those who are sick, not just from COVID, but others. And we know this is a difficult time for many personally, for many businesses, and a number of others throughout our state. And we trust that the message that we give today isn't an easy one, but it's an important one. And as Dr. Pond mentioned, that rapid rise in cases, that together we can come come together again to not just reduce the slope of that curve, but ultimately flatten it, crush it again, and get our whole state to a better place. So with that, I look forward to seeing you next week, and I wish each of you a safe and enjoyable weekend.